Welcome everyone to a brand new webinar with Gotham Plastic Surgery and Dr. Philip Miller. We're very excited to be here today talking about microsurgeries, which are targeted techniques with less downtime. Dr. Miller has a great presentation planned, and then we will open up for some live question and answer. And so we are very excited to get started. Before I pass it off to Dr. Miller, if you don't know who he is, he doesn't like when I brag about him too much, but he is an incredible double board certified facial plastic surgeon. People fly in from all over the country and even all over the world to see him. He sees patients and does surgeries in 2 locations in this country, one in Manhattan. That's where he has been for how many years now?
Too many to remember. No, at least I've been actually
20.
This year celebrates my 20th year at this location. Over 27 years in New York City, now almost 5 years in New Orleans. Can't believe it's 5 years already.
New Orleans,
but 20 years at this very location. Renovated, by the way, beautifully renovated.
Yes, beautifully renovated. And it's such a beautiful office right in Midtown, right by, beautiful views. So, but we did have a lot of demand for people in other places in the country. So about 5 years ago, Dr. Miller started going down to New Orleans to do surgery. So for those of you tuning in from anywhere around the country, you have 2 options for where to go to get surgery with Dr. Miller.
Yes, indeed.
But anyways, hopefully, Dr. Miller is a double board certified facial plastic surgeon. So he's an expert and only focuses on treatments on the face, facelifts, rhinoplasties, all the things we're going to talk about today, which is unique and not what you see with every plastic surgeon out there. So, and I also just want to remind you guys, I know we always talk about Dr. Miller as the surgeon, but we do have a full med spa as well, where we're doing tons of great treatments, everything from injectables and lasers, peels, microneedling, cool sculpting. So don't forget about us as your med spa provider. All right, Dr. Miller, the floor is yours.
Yes, indeed. All right. Well, thank you so very much, Risa. You're always so kind, and I'm always a little bashful when you say such nice things about me. As my dad taught me, you got to prove yourself every day. So I hope I am doing just that again tonight by sharing with you some of my passion and interest in the field of facial plastic surgery, particularly some of the procedures I've developed. And I have to, right off the bat, I have to thank my patients, because a lot of these procedures came to me because patients would come to me with a challenge and say, you know what, Dr. Miller, yeah, it's fine that you can do X and Y, but I want Z. And it's great that you can do this, but I want that. And right around the time when patients were, and this has to do with the Microlift face, right around the time when patients were really sort of interested in this mini lift, which was a very small little incision around the hair and in front of the ear, I had a patient who came to me and said, that's too much. Even that's too much. I want you to limit it. And then a patient after that came to me and said, even your modification, which was just a small little incision in the hairline, came to me and said, modify it even more and put it in the hairline, as where I've now developed it. Again, I really want to thank my patients. I'm so devoted to you because you have helped me push the envelope and make procedures possible by narrowing the constraints on which you would allow me to do things, but in the process, push the envelope and really push our field to ever better results using less and less invasive techniques. So with that, give me just a second. I'm going to go ahead and start the screen here and start our presentation. And then Risa, if you wouldn't mind, just make sure that this is all appearing properly, if that's okay.
Absolutely. It
You
looks
got that?
great. It looks perfect.
All right. So welcome everyone again for the topic rhinoplasty, microlift face, microlift jaw, and microlift neck. These are micro changes, but big differences. And I'm very excited to talk about it. We're going to talk about rhinoplasty right off the bat. And it's been extended over the years on what it can actually be applied to. But this case just came in a couple of weeks ago, maybe a couple of months ago, and defines what rhinoplasty was really intended to do. And then you'll see how I expanded it from that. Why I developed the rhinoplasty all along. Now it's been extended and patients come in with big bumps and they want to know if they're rhinoplasty candidates. And sometimes they are, and I can adjust the procedure. But Abigail is the original. Abigail was the reason why I created the microrhino, and you can see she's got right there on the tip of the nasal bone, she's got a little bump right here, and I'm going to just show you, and that's all that she wants. So you'll still be able to feel down here, the tip of the nose. Even on this side, I didn't inject on this side. It's just this area right here. I'm going to come on the inside of the nostril, come right up under the skin, and focus on that bump right there. And everything. And you hear that's kind of scraping noise? Mm-hmm. That's me getting the bump all set and prepared. Now that is, again, not in her nostril. That's in the nose, the nostril itself, but over the skin.
Oh my God, that's amazing.
Gone?
Yeah. Is that like
How easy was that?
Bye-bye bump. Individuals who just have that small little bump right over here and they want just that little bump to come out, that's what you came in for. But the real reason why you gotta love this video is her accent. I mean, everybody loves an English accent. Although, is it English or?
It is English. Yeah.
It is English, right? Yeah.
I get Australian a lot.
I was gonna say it might be Australian, but you said bye-bye bump.
Bye-bye bump, and it came off on Saturday, 4 days after, and it was really emotional. I was so happy to see it, and it made such a huge difference.
Oh my God, and it's completely gone. As you can see, you sort of slide your finger down, it's not there anymore. We've got symmetry throughout the face. That's what micro-rhinoplasty was all about. Thank you so much for sharing your case.
Thank you.
I'm Miller for Post Op Mondays. Have a great day, everyone. So again, you can see right here, that's exactly what the micro-rhinoplasty was intended to create or sort of fix. A small little bump right there, sort of what I call either a bump on a hump or just a small little bump, and to reduce it. And this is just maybe a week later or so. Very, very quick recovery period. Patients are having the procedure, as you saw, completely awake and alert. We're talking to them. They can feel the bump afterwards to make sure that the bump is gone. Patients are absolutely thrilled. We can do minor bumps, and we've extended it now to even beyond just those small little bumps, as I was alluding to, and we can do bigger bumps. Again, why? Because my patients, I love them. They push me and they're like, look, doc, I know you can do it. Let's do more than just take a little bump off. And so I've been able to extend it to beyond just a small little bump, but also, as you can see in these photographs, removing a little bit of a hump as well. So the micro-rhinoplasty is quick. It's 15 minutes. It's under local anesthesia. As you saw, there's no external sutures. The sutures are placed on the inside, a fast recovery. There's absolutely no tip work being done. Keep in mind with that. And I'm not fracturing any of the nasal bones. I'm really just removing small bumps and small, medium-sized bumps. Now, I can't take out larger ones. And the reason I can't take out larger ones is simply that when you start taking out too much, you create gaps in the bone and gaps in the cartilage. And then that becomes really, really obvious. So can I take out some cartilage? Sure, I can take out some bone and some cartilage, but I have to be careful about taking out too much, because when I take out too much, you get something called an open roof deformity. And that open roof deformity necessitates that I now convert it to a more traditional rhinoplasty. And so there is, in fact, limitations to micro, but by all means, I can do a lot more than I used to do when I first introduced this concept almost a decade ago. So that's the concept of micro-rhinoplasty, but now I'm excited to introduce you to another passion I've had for a while now, which is using microsurgeries in aging face. Now, I have this diagram here to explain something. On the left, you're going to see the word Microlift. Now, that's an actual procedure, but I'm also using it in this diagram just to convey a concept. I can do sort of a micro procedure. I can do sort of a mini procedure. It's a little bit more. And then I can do sort of a mega procedure, right? So something very small, a little bit more, and everything, right? Well, let's take a look at this person who comes to me at the age of maybe 65, who looks a lot older. And she says to me, doc, hey, what do I need? And I look at her and say, well, without question, you're going to get the best result if I give you everything. If I throw, if you will, the kitchen sink at you, I can really do some amazing results. But I don't have to. I could also do much less, and you would still get a nice result. And even if I do just a little bit on you, you're still going to get a little bit of a result. But you'll get a result with all of the techniques. But clearly, you're going to look the best going from old to young if I give you everything. Now, for a younger individual who comes to see me, why would I want to give her a huge procedure? She's not going to have any different in the result if I do a large result, a smaller result, and ultimately, I was pushed into creating a really small kind of procedure to give her a result that she could get even if she were to have a more involved procedure. And that's why I designed the Microlift facial part. The Microlift is an incision placed up here in the hairline, and it's a very simple technique because you, the patients, are going to tell me where I'm going to put that incision. I ask you to take your finger on either side. You're going to put it on your temple, and you'll elevate it. You'll raise it towards your ear or towards your scalp, and you're going to move it such that you get really nice movement of the mid face, the lower face, maybe even down at the jawline. And I'm going to follow that line as it goes up into your hair-bearing skin, draw a line perpendicular to that, and that's where I'm going to do my work, pulling up the deeper tissue in that direction in order to treat the face. Now, the next slide is a little bit graphic. I apologize for not warning you that the micro-rhinoplasty was going to be a little graphic, but this one will be as well, but it's really not that bad, I promise, okay? But this is showing you a really nice result on what a Microlift can do. Again, a small little incision. This is the line. She came in and she goes, this is what I want. I want it pulled up over here. I drew that up into the hairline, perpendicular to that. I made a little incision. I'm grasping the layer deep to the skin. I don't want to pull on the skin. I want to go deep. That's called the smash. And take a look at the result I can get. Small little incision in the temple, and you can see how snatched she looks. You see that entire face hook up.
Perfect.
You like the way it feels?
I love it.
That's the kind of results you can get, and this is the kind of results that you can get with that. Notice the improvement in the mid-face cheek. You can get an improvement over in the jowl, and again, this isn't someone who has a huge jowl to begin with, but you can get improvement in that early jowling, and you can get improvement in a little bit of the jaw line as well. Now, it will be dependent. Certain individuals get better results, other patients not so good results, but you get a good estimation of what you're going to look like while standing in front of a mirror and taking your fingers in your temple and pulling up and seeing how much I can improve that mid face and how much I can remove some of the sagging in the mid face and how much I can improve the jawline as well. And it's really applicable to men. It's applicable to women. Yes, without question, I'm seeing more younger women, but I'm applying this as well to older individuals who've had facelifts and who want just a little bit of a touch up, who want a little tuck up, but don't want to undergo major surgery anymore. So I'm not just doing this on younger individuals. Here's an individual, here's an example for a man. You can see there is a little bit descent and a little weakness in the mid face. And I just pull that up, hidden in the hairline, pulls it up. You get a great improvement in the jawline, improvement in the mid face, and with really no change at all in the hairline itself. Again, another case of the Microlift face where I'm improving the mid face, I'm improving the jawline. And finally, you can see this again, a great example of what the Microlift face can do. So it's a small incision that's hidden in the hair. It's done under local anesthesia. Totally, if you want it, we can do it under IV sedation. Only takes around 45 minutes, and that's honestly by the time that I start injecting the area to almost by the time that I'm done. There's minimal to no pain. I tell all my patients, today is not the day that you have to endure any discomfort. Today is the day that I want you to relax and enjoy yourself, aside from the first pinprick that I'm doing in the hair in order to numb the area. After that, I want you basically relaxing and being able to fall asleep. I don't want you having any pain. I put on a head wrap for around 48 hours or so, and you're back to work within 24 to 72 hours. I did this procedure recently on one of my employees, did it on a Friday. She was back to work on Monday. You had you really couldn't believe that we did it. And of course, natural looking results, and you see those results immediately. Now, is it for everyone? Can anybody have it? Well, there was a limitation before on who this was worth. It's who this would be applicable to, and where there was limitations. And it's on individuals that you might be surprised. For example, this individual. Really nice jawline, a really nice neck, wants a little bit more improvement on some of the sagging skin, and you might think she's an excellent candidate for that little Microlift. But look what happens when I do this. I give her that Microlift maneuver, and she develops all this extra skin right here in front of her ear. And there's nothing that I can do about that. I have to remove that skin. So she's not a candidate for the Microlift, but she could be a candidate just for a little mini lift where I extend the incision from where the Microlift is down in front of the ear to get rid of this skin. And since I'm making this incision anyway, well, then I can go ahead and just give her a little bit more of a lift that originates down here. And so here's what's interesting. You know, I imagine this makes a lot of sense to you, right? Oh yeah, of course you've got all this extra skin. Well, guess what? This isn't a complete contraindication. I've been able to figure out a way in which to take these kind of results and take these kind of individuals where I've typically had a limitation, and figured out a way to make it that I can do the Microlift in these individuals. And what I do is I'll come down here and I'll lift up this skin, because right now I don't lift up this area. But what I do is from the Microlift incision, I'll come down, I'll sort of lift up this skin and just let it redistribute, let it redrape, particularly in front of the ear. See, this is a mobile skin, and in front of the ear, the skin is adherent or stuck to the underlying tissue. So if I just elevate this and I let it redrape, I'm finding that I can extend the Microlift to individuals who would previously been excluded from the technique as depicted here. But we have something new and very exciting to share with you. So may I have a drum roll, please? And this is the Microlift jaw. Again, I have to thank my patients, because after having done the Microlift face, where you've been seeing the whole time, I had a patient come in and go, "Doc, I love it. It's great, but I also now want it for my jawline." And I said, "Really? You want sort of like a pull at the jawline?" And they said, "Yep. And I want minimal incisions. I don't want anything to be seen. Design that for me." And this is what the result was. This is the snatched jawline. Again, same principle, small little incision. Instead of placed in the hairline, I'm placing it behind the ear and then grabbing some tissue. And you can see the kind of mobility here that I'm getting. And in so doing, really defining the jawline, the angle of the jaw, getting rid of those jowls over here, and defining the underneath of the jaw very well. So you've got the Microlift, which is up here, and then the snatched jawline coming in right here with an incision behind the ear. And as the depiction there says, there is a little dimple right there, but once I suspend the area, I'll release that and you'll be able to see the existing jawline defined extraordinarily well. Now, this isn't for anyone. These micro procedures really are somewhat patient dependent, because I've had patients come in wanting the Microlift jaw, and when I pull it back, their mouth gets stretched and it doesn't look natural. And it's partly because they didn't get a Microlift face. So I sort of have to do a Microlift face first to elevate everything, then do the Microlift jaw if they want to get the benefits of that jawline. In other individuals, like this person you're seeing right here on the screen, she looked terrific. I was able to do the Microlift jaw maneuver in the office. She looked terrific. She was a great candidate. And that through that incision, which is behind the ear, gave me the incentive to extend that micro access technique to not just the face and jaw, as you see here, but also the neck. And so it is through this incision that is done behind the ear, as you just saw, that I'm now able to come forward and grab this tissue down in the lower face and pull up to give you a micro jaw lift, a micro lift of the jaw. But from that same incision, I now can come down into the neck and grab neck tissue and pull that up to not only improve the sort of crepiness of the neck, but also the contour in the submental area. And I have a very early example of that individual right here. You can see this person has the lines in the neck, and I know, I apologize, this isn't a classic photograph. I had them send it to me just recently, so we don't have a studio picture for you, but I hope you can get the idea that this neck itself has been improved, because it's not just been pulled back, but it's been raised up, eliminating these horizontal lines, and the neck contour itself is much less bulging, and it's much more contoured. And again, apologies for the hidden, this isn't hiding anything. It was just sort of in the way. And I wanted to get this picture for you for tonight's webinar. So, the aesthetic industry is getting a lot of sort of criticism online because people are sort of either angry that you're trying to do something to enhance yourself and make yourself feel better about yourself. But beauty is really a state of mind. And if it's bothering you and you're feeling self-conscious about it, I'm giving you the empowerment to do something about it and change it. These micro procedures, they're not designed for everyone. They're not designed to make drastic changes, but without question, they can significantly change how you feel, because it really does make those minor changes that you want. And it is able to cultivate that inner harmony and confidence that I think is the goal of all cosmetic procedures. And certainly it is in my practice as well. So I leave you with that. Please, if you enjoyed this presentation, I encourage you to follow me on Instagram if you don't do so already, plus TikTok and my YouTube channel, which is almost at 10,000 subscribers. So I'm really excited to hit the 10,000 mark on YouTube, and we're about to hit the 20,000 mark on my Instagram. So please, those of you who haven't yet, please go ahead and sign up for my Instagram account. I'm excited to break 20,000 this week. Please share questions or concerns that you may have. I'd love to answer questions if you have any today, and we will be happy to address those. And I just got to close this. And Risa, we should be back, just
We're
the
ready.
two of us.
Thank you.
And I am all set. Thank you, all of you who have stayed to listen to that. I hope you found it interesting. And we love doing these because we really get such great feedback from all of those who are observing and watching and giving us your questions. So with that, I'm going to hand it back to you, Risa, if you have any questions from the audience or from those who may have sent in questions before.
Perfect. So yes, thank you so much, Dr. Miller. And as everyone said, this is the time to pop in your questions. All right. So this is the first question. Dr. Miller, thanks for this. First of all, how long do these procedures last? It's a two-part question.
Okay. Yeah. They last around 5 years. So I just want to make it clear. These are not, you may have heard of thread lifts, right? And threads are just sort of a barbed kind of device that gets placed in locations and then pulled up on. And I love the theory of threads. They just don't last. And so I wanted a solution that could give a thread-like result, but last a lot longer. So I'm using not threads, I'm using sterile surgical string. Sterile surgical string has a name, and it's called a suture. So whenever you hear a suture, that's what it means. Now, threads are a version of a suture. They're just single and they're barbed and whatever, but I'm using permanent sutures and actually performing a technique to totally reposition the tissue here. Add a deep layer, the SMAS layer. So it's lasting at least 5 years. I'm having patients come back. I just like you saw on that diagram at first, you're going to sort of go from mini lift to micro lift to mini lift to mega lift. So I was expecting my micro lift patients to come back 5-6 years later, ready to go. Okay, I'm ready for my mini lift. And guess what, Risa? They're coming back and they're going, okay, I'm ready for another micro lift. And I'm just repeating the micro lift on them, and they're looking terrific.
Wow, that's great. Okay, and then second part of this question was, I'm a professional dancer. How long would it take before I could go back to fully dancing and performing?
Yeah, for something like this, I would say, well, two things. On one hand, I would say 3 days, you're fine, you're good to go. On the other hand, I'd like to say, I would just ask you to do that being a little careful, that if you're feeling strain or stress on the area, don't ignore it. Appreciate it, recognize it, give yourself some time to rest. But there really should be no reason that after around 3 days to 5 days, you should be able to go right back to doing what your normal activities are.
Got it. So someone else had a similar question. So how soon can they go back to exercising?
Yeah. And again, exercising is relative. If you're going, I want you to just listen to your body. And if your body is starting the exercise and you're getting throbbing anywhere that I've operated and it's starting to hurt, then your body is telling you don't do it. That being said, plenty of patients 3, 5, 7 days later are going back to their full exercise routine and not having a problem. Let me put it like this. I haven't had a patient, the only patient I've ever had a problem with, if I can remember, it's someone who actually hit themselves accidentally. I think they got up in the middle of the, I can't remember what it was, but it wasn't from exercise. It's because they actually hit themselves and they got a complication and I had to fix it. But so far, no one has ever had a problem. So keep pushing the limit, my patients, and let's see how quickly you can get back to your exercise.
So within a few days. That's the
Right,
beautiful thing of these microsurgeries. Okay, so can you tell us more about the aftercare and recovery for the micro?
And are they specifying specifically, Risa, on which procedure?
Microlift. They didn't specify
right. So you got the Microlift, you got the Microlift face, you got the Microlift jaw, and you got the Microlift neck.
Face. She said
and
face.
So from the Microlift face, there'll be a little, as I mentioned, there's a little incision here and here. A bandage goes on just to compress the tissue for around 24 hours. And then after that, you can take it off. I sort of like to say, if you don't mind wearing a compressive dressing for maybe another day or two, why? Because swelling typically peaks at around 3 days. So you're thinking that the swelling is worse right after the surgery. No, it tends to get a little bit worse over a course of 2 or 3 days. So if you can keep some compression in that area, that's the best. But I just want it for 24 hours. And then after that, if you don't mind, press it when you can. That's it. For women, there's really not an issue. They've got longer hair and it covers the Microlift incision. So you can literally go out the next day. No one's going to notice anything. They're going to see how good you look, but they're not going to notice anything. For men, if you've got shorter hair, then you might be a little self-conscious because sometimes you can have the incision sticks out a little bit. So you compress that, wear a baseball hat, wear a hat. No one will be able to tell that. That's all that you need to wear. And then you're good to go the next day.
That's amazing. So, how long are the scars visible for? I mean,
well, for the Microlift, they're never visible, right? Because they're in the hair. So in fact, I had a patient come to see me, I guess it was this week, who was feeling it and going, yeah, can you do something? And I said, why? I said, because I feel the bumps. And I said, but you don't see it, right? And she said, yeah. And I said, well, anything that I would do to make the bumps go away could potentially interfere with the healing process. So just leave it alone. Trust me, it'll resolve by itself. You can't see, if you saw it, I would, but you can't see it, right? And she said, yeah, you got a good point. I don't see it, but I don't like the way it feels. I said, no problem. Give it one more week. If you still don't like the way it feels, I'll go ahead and I'll just take some of the sutures out because I put sutures in that dissolve. So I don't have to take the sutures out. Once it's in, you just let nature take its course.
So after doing these treatments, you can wear your hair back in a ponytail, women?
Oh, yeah, absolutely. No problem. Yeah.
Great. So this patient said they were referring to both the micro neck lift and the cutting behind the ear and hairline. Are those scars?
Yeah. So once you start getting behind the ear, then it really is patient dependent. And I'll tell you why, because it depends how much skin gets transmitted back to this area that I now have to hide behind the ear. And the more skin that I hide behind the ear, the more I have to operate on. But we're still talking within like 5 days, right? We're not talking about a 2-week recovery period. We're not, but I may have you want to compress that area and put some ice on it for maybe 2 or 3 days, 4 or 5 days, as opposed to just a 24-hour period. Again, if it's a little change, it's a quicker period. If you need a lot to do a bigger transition, then it's going to take a little bit longer. But again, nothing more than 5 days.
That's incredible to get those results with just a couple days. So can this also work for laxity in the neck? My main concern is the lower face and neck, and Catherine.
Yes, indeed. Yes, it absolutely can. And so from that incision from behind the ear, I'm able to come down, grab the tissue in the neck and pull it up nice and tight. And then what about the extra skin? Instead of cutting out the extra skin, what I do is I lift up, because the skin, here's the trick. The skin behind the ear is adherent, right? Try to move that skin. It doesn't move very well, right? And the skin over here moves a lot better. So why do you get kind of fullness? Because you're taking mobile skin and abutting it against skin that doesn't move. So what I do is I lift the skin that is that's typically fixed to the underlying tissue. I lift that up and I let the mobile skin recede into that area, and I distribute into that new space and then push that skin down without making any incisions, without cutting out any skin. I'm just sort of redistributing it, and it works, and it works great. Now it's a little bit of a recovery period because I'm now I'm waiting for this whole area to stick down again, but you can go out to work, you can go back to work. You don't have any incisions here that need to heal. You just have skin that's been elevated that needs to stick down again and decrease the swelling. What you're really going to feel is swelling more than anything else.
Got it. So are there drain tubes being used for this?
I typically don't use drain tubes, but if there is a larger area that I'm operating on, and if you're sort of oozy during the case, then I may consider putting one in, and I'll take that out after 24 hours, but I don't have to do that. Again, drains are your friend. I don't know why they get such a bad rap. They're your friends. They get you recovered quicker. It's sort of like going, well, I want surgery on my knee, but I don't want to wear crutches. I mean, crutches, why not? You're taking tension off of your knee. You're going to heal faster. And that's how I think of drains. Yeah.
That's a great analogy for it. So one person wanted to clarify, when you say compression, what do you mean? Like a bandage?
It's an elastic bandage. Yeah. Think of an ACE bandage, except it's a customized ACE bandage that's going to go around the head to compress the areas that we operated on. Yeah, it's not at all like a big, huge bandage like when I do a facelift, where it's really like, I call those more helmets than bandages. But this is an elastic band that basically goes up and around. There's a little Velcro on top that can adjust how much tension and pressure goes all around the band. I wish ideally I could create a system that allows pressure just to this area, but you've got hair above, you've got different contours below. It's sort of hard to apply a compressive dressing. It's easier to put a bandage on.
But the patient themselves could take it on and off and adjust it.
Patients themselves take it on and off. Exactly. So when I put it on for 24 hours, you guys take it off. When I put it on, you guys take it off in 24 hours. And then we'll do a little Zoom. I'll make sure everything looks okay. And then I would say probably half the patients put it on for the next 48, and probably half of them tell me they did and don't.
So that means if you work from home, like I do, you could be wearing it, but then you need to be on a video call, take it off for 15 minutes and then put it back on, right?
That's exactly what patients do. Absolutely.
Great. So how soon after a Microlift can I wash my hair?
24 hours later.
Beautiful.
Yeah. And this whole notion about like dyeing hair, I mean, it's funny. We learned a lot about things by sort of mistakes. And I don't mean my mistakes per se, but I guess you could have, I mean, penicillin was found by a mistake, sort of, so to speak. So a patient of mine, and I'm referring specifically, which is inevitably going to be the next question, or how soon can I dye my hair, right? And I don't want to subject a patient to a trial of, you can do it 2 days later if I'm wrong, right? I mean, well, what happened? A patient totally forgot she had the surgery, and 3 days later dyed her hair. And then came in and saw me and was like all nervous. And I said, well, let me take a look. I said, you look fine. There's nothing wrong. It's healed. Nothing's going to seep in there. We all know the dye isn't permanent anyway, right? So don't worry about it. So now I can tell you, you can dye your hair within 3 days. You'll be fine.
Now we know. Now we know. All right. So thank you, Dr. Miller, for the great presentation. Do you have this Microlift procedure for the brow area to correct slightly drooping eyelids? And if so, what's the recovery time?
Well, thank you very much. I don't know who asked that question, but I do. And we didn't include it in the talk because I think I just didn't have any examples of it or surgeries. So yes, we do have the Microlift brow, and that's really just a brow lift over here. it's an incision that's higher than where the Microlift is. I put that incision up around over here, elevate the skin, elevate the lateral brow. And depending upon how, I guess the other reason that I was a little maybe hesitant is that it's similar to a facelift where in some patients, look, a Microlift isn't going to work, a mini lift isn't going to work. You need a full facelift. And in patients who need the Microlift brow, the brow component, some of them work great for the Microlift brow. Others, look, you're just going to need a full brow repositioning or brow reshaping. It's not going to work with just the micro component alone. But often if you do with just one finger, you like it, and one finger here for your face. And you can see I get some movement here with my face, I guess. I got to
No, what are
teach
you going
someone
to
how
do?
to
Your
do
own
this.
surgery?
Yeah, I got to do my own surgery.
That will be a good Instagram live. All right. Here's another one from Anonymous. Love the seminar. Great results. Does microsurgery have the same long-term effect as a procedure that takes 3 to 4 hours? What is the difference of a jaw lift that cuts immediately behind the ear versus cutting behind the ear following the hairline? I would like something that would last 10 years.
Yeah. I can promise you that, just keep in mind, I can promise you that something will last forever as long as you don't eat, sleep, talk, chew, smile, swallow, that'll last forever. So, and where do we come across these notions of it lasts 5 years, 10 years, 15 years and the like? And the answer is, it's not that they look like they did immediately post-op for 10 years. The real definition of that is that it's typically at the 10-year, 15-year mark that patients come back and go, okay, I want to have something else done. Now, at 5 or 6 years after a full facelift, they don't look like they did immediately after the facelift. They look good, but not like that, but typically enough to make them happy so that 10 years, 5 years later, 10 years after the original surgery or 15. Now, the micros can last 10 years in that respect because it's doing in some respects the same kind of lift as the major kind of changes that you're going to get, because I really do release everything. When I'm doing the micro lift neck, I'm releasing all the attachments that you would get with a traditional neck lift. I'm just doing it through a really small incision. And I'm not making the incision in the back because in my estimation, you don't have so much skin that I need to resect it. So yes, I do have to convert it to an open neck if you have so much skin that after I lift you up and then everything, there's just so much skin I have to remove it. Now, how is that different than, let's say, a full neck or a deep neck lift? Everything I'm talking about right now for the micro lift neck is on the side. I'm not doing anything over here, and I'm not treating anything under here. I'm not treating the deep fat, and I'm not treating the submandibular glands. It's really a lift that you're doing by going like that, okay? And once I'm doing that, as far as I'm concerned, I'm doing the same thing that you would get with a full lateral or side, or as you put it, behind the ear and into the hairline neck lift. And so it should last as long as a traditional neck lift.
That is amazing. And that kind of honesty that you guys are hearing from Dr. Miller, I'm so glad you get to hear it, because that is why patients fly in from all over the world, because yes, he can do the deep plane facelifts, but he'll tell you the truth about what you need.
Yeah. Oh, my Lord. I had patients. I'm honored. I had a couple of patients, and one of whom was actually the wife of a colleague. So it's a real honor from when I'm very grateful. I'm really genuinely humbled when I see patients come in from around the country, around the world or so, to come in and see me, particularly when they're colleagues' wives. And I mean, Risa, this woman looked absolutely beautiful, and she went in to see someone who said, you need a deep plane facelift and a deep neck lift. And I looked at her and I was like, where, how, what to do what,
Sure.
and she said, to do this. And I said, yeah, you need a Microlift to do that. You don't need a deep plane facelift to do that. That's overkill, and it's not going to last any longer. So I'm going to be honest. I'm going to tell you the truth.
Yeah. Well, unfortunately, that surgeon was going to quote a lot higher for that, of course, but All right. Miss Emily says, would you consider these micro procedures sort of prevention? I have laxity in my neck and I'm trying to get ahead of my genetic turkey neck that I worry is in my future.
Great question. And the answer, in short, yes. I always like to say I was trained on the 6 train. And by that, I mean that I would take the 6 train from my home to work every day. And what I loved doing was looking at everybody going, why does that person look 20? Why does that person look 30? Why does that person look 18? And the answer is because there are all these subtle changes that occur, which make us look 20, 25, 30, 35. And so you're right, doing these techniques earlier allow us to prevent the aging process. And I wouldn't do it, for example, I'm not going to do it on someone who comes in and who, when they do this, there's no change. No, that's ridiculous. Have something so that when I do this, you get an actual change, right? If you come in and you're like, well, I'd like this at Preventive, but there's no manipulation at all of the neck tissue, I'm going to say, don't worry about it. Come back when you start seeing that there's a benefit, and then we'll jump on the bandwagon early as opposed to later. But there's no sense in doing it if we can get 10 years or 5 years without having done surgery, that's fine.
Yeah, I love that conservative approach. So any scarring that you might have from these microlifts, would that impact you having a more deep plane facelift later?
Absolutely not. No. All of these incisions really, it's not so much the incisions, it's the flap elevations, which are being done in a plane that is, it's a glide plane. So it's a plane that once you get into it, just sort of opens up, and it does not prevent you at all from undergoing more involved procedures down the road at all. In fact, these procedures leave all of those other planes completely intact, and they don't touch those. So when you do go in for a larger procedure, it's virgin territory.
So here's a good question. I have done a neck suspension suture lift elsewhere, and I don't like my results. Could I be a candidate to get a micro lift to fix my neck and jawline?
Absolutely. Yes. And, again, look, not all suture suspension techniques are the same. And why? Because it may be different based on the suture that was used. It may be due to the plane that was used to pass the suture. Now, you've got skin, you've got subcutaneous tissue, you've got muscle, you've got SMAS, et cetera, right? And those are all different planes. Those are all different depths. And if you don't suspend that suture in the right depths, you're not going to get a consistently long result. What about where that suture is suspended to, right? If you go ahead and suspend it to something that's weak, it's going to fall. If you suspend it to something that is firm, it will last. If you suspend it to something that's firm and is much more, if you will, in towards the neck, you're going to get a better one than if you suspend it to something that's firm, but it's sort of out here, in which case you don't get jawline definition. All of these subtle things is what all of those combine to make a significant difference between what one would say is just a suture lift in one case and a suture lift in the other case, but they're fundamentally different based on their execution.
Got it. That makes sense. So, all right, a lot of people are curious about how much this costs. Is there anything you can tell them, or if not, what should they do to find out?
Yeah, I would say most of what we're talking about is in, I think I wish Clay was in here, is in around the $9,000 and up range, depending upon what it is that is unique to you. And that, plus the anesthesia, if you want anesthesia and facility fee. But if you're interested, then by all means, please contact the office. You can just text us at 212-750-7100. Once again, that's 212-750-7100. It's on my, actually, yeah, I think it is on my website. It tells you what number to text to, or you can email us. What's our email?
I'll pop this in the chat as well.
Yeah,
right
I think
now.
it's, you can put it in the chat. You can email us. You can call us. You
Patient
can text us.
advisor. I'll pop.
Patient advisor at GothamPlasticSurgeryNY.com. Come on by the office.
I'll pop those in
you know.
right now.
Thank you so
Um,
much, Risa.
and you also can book online on our website because I know it's getting
right.
late on the East Coast. So I'll pop in all of that really quick.
Yeah, you can just go on to the website. That also has, now it doesn't have every single opening. So that's why if you don't see something for quite some time, call the office, because I don't know if we put every one of our spots online, so that we give patients who are calling an opportunity as well to book up.
Yes. Well, that leads to another good question. And we have about 10 minutes left, guys. We have a couple more questions to get to. Stay with me. So, Deborah said, I love Dr. Miller and his team. I fly from California to see him.
Oh, Deborah, I hope everything is well with you. And I think I know who you are. So we miss you very much and look forward to seeing you. And I am very happy for you.
So Ruth is saying, what is the wait time to get surgery scheduled?
I don't know. I sort of joke around. I just work for everyone else here, that I just come in every day and they tell me what to do. So Clay would have the answer for that. And so I would just ask you to get in contact with the office. It's a lot. You'd be surprised, I would say, because number one is days that you may want, I'm totally booked up 7 months from now, and days that you are available, I might be open in 3 weeks. So I would really say just give the office a buzz.
Yeah, absolutely. And, Clay or a member of our team will help take care of you. We have lots of patients with complicated travel schedules, and we do our best to get them in. All right. Well, thank you for speaking about that. Let's see. I'm not sure the answer to this one, but can you do any microsurgeries for a bulbous nose?
Well, I wouldn't call, I would, here's what's funny. I'm going to say almost, and I'll tell you why. Because I had a patient who came in just this week who said, can you do a micro rhino? I'm going to go, yes. And she goes, can you do because she only wants it under local. So I sort of right off the bat am putting microsurgeries under the category of either local anesthesia but you're not getting general, you're getting up and you're being able to go home and quickly. So she said, well, could you also just make my tip a little bit more narrow and raised up? And I looked at her and said, as long as you don't mind, I would mind, but I have to numb this area. Once I numb it, yeah, I can probably do what you want me to do. I don't know if I would necessarily call it micro but it would be a tip plasty. So it is a micro tip plasty in the sense that I'm doing it under local anesthesia, and I know ahead of time I'm not doing too much. And on her, I think I'm doing it on her. So the answer to your question, for purely a bulbous tip, if all you want is the tip to be made a little bit more narrow, maybe a little bit more rotated, yeah, I can do a micro tip. But again, the only hesitation is tips can be a little tricky where you don't get exactly what you want. And if we're doing just a micro tip, my hands are tied. So that's where my only reluctance is. But you know what? Again, my patients have been amazing. They've let me, I tell them, as long as you're okay with this, let's try it. And that's where I got to doing the Microlift face, jaw, and neck at this point. So give the office a buzz. And if you happen to be one of the first 2 or 3, I'll try it and we'll see how it goes.
Yeah, absolutely. And just in case, Dr. Miller, you guys know that we didn't talk about it today, but Dr. Miller is he's incredible with doing all types of nose surgeries. You can look on our website. We have hundreds of cases of incredible rhinoplasties of all shapes and sizes. So even if he can't do it with the micro technique, obviously, of course, he can do it.
Oh yeah. Let me make it that. Thank you, Reese. Let me make it perfectly clear. I'm not saying I couldn't do it. It's can I do it using the micro techniques that we're describing here, which really mean under local anesthesia and with sort of an assuredness that by the end, I'm going to give you a result that you want, without having to now start extending it into a bigger operation, which obviously defeats the whole purpose.
Absolutely. Okay. Well, that was amazing. I think we got through most of the procedures. Oh, okay. One last question, and then I'll get to the wrap up. So can you do more than one of these procedures at the same time?
Absolutely. And that's in fact what we're finding our patients are requesting now. Often patients were coming in just for a microlift. Now they're coming in both for a microlift and a microlift brow, a microlift and a microlift neck, a microlift and a micro jaw. So yeah.
And it's probably a little bit more cost effective too, right?
It is, because it's one recovery period, one facility fee, it just makes a lot more sense for everybody.
Sedation. Yeah, absolutely. And just so you guys all know, our surgery center is right in our location in Manhattan. So it's controlled and very safe. Dr. Miller set it up himself for exactly his surgery.
JACO accredited. Yes.
Yes.
It's independently verified, but yes, we set it up for our patients so that it's, that you've got privacy, you've got sort of complete sterility in mind and health, making sure everything is to the best that can be for your particular surgery, but also have the kind of security as well as privacy that patients would like when they're having these kind of procedures.
Absolutely. So thank you so much, Dr. Miller. I want to remind everyone, for those of you that joined us live today, we are so grateful of that. And each of you have an amazing deal here. You're all eligible to get a complimentary consultation with Dr. Miller.
Congratulations, everyone.
Yes. So there is no reason why every person here shouldn't have at least a conversation with Dr. Miller, hear what he thinks, what he might recommend, whether you do it now or later. I highly advise you all to take him up on that opportunity. And if you do decide to proceed with any microsurgery before summer, you will get a complimentary Botox and a laser peel complimentary.
Wow. Who comes up with these deals? How come I don't know any of
we
these?
negotiated some good deals with some of our reps to help support our patients and keep them happy.
I tell you, I work for you guys. I didn't really, that's pretty darn good. I want to sign up for that.
Yeah. So you can get the laser peel or RF microneedling in our med spa, which kind of complements the journey and just helps you look even more beautiful.
Yes, it does. Yes, indeed.
So please make sure to get your consult in right away to make sure we can book your surgery before the end of June. So Dr. Miller, thank you so much for your time. I know you're tired after a long day of seeing patients and surgeries, but it's so helpful to hear this education. And I love that all the patients can hear how authentically genuine, transparent you are. And, you know, this is why I encourage you all to get a consultation with Dr. Miller. You're going to be very happy.
Risa, right back at you. Thank you for making this so easy. Thank you, April, for helping put the presentations together. Thank you, Clay, for being there for the patients, and Zane and Jose and Adina and Carmen and Zane. I mean, everyone really, it's a team effort. So thank you, everyone in the practice, and Risa again for putting this on and doing such a wonderful job hosting. I'm very grateful.
Thank you so much. All right. So good evening, everyone. And we can't wait to see you soon at Gotham Plastic Surgery.
See you later, everybody. Take care. Bye-bye.